My name is Emmy Swift, and I am a graduate student at Morningside College. I also work as the program director of a special education school in Greeley, Colorado. I did research over how interventions in the classroom can help students with mental health disorders cope with season changes. The problem is that environmental factors such as season change are one of the main triggers for people diagnosed with mental health disorders, according to research by BOSO. In a survey completed by 590 teachers, 75% reported that they have worked with students with mental health disorders over the past school year. 34% of these teachers said that they felt unprepared to support these students in their classrooms. Why me? I chose this topic because I was noticing a spike in student suicidal and aggressive behaviors during times of season change and wondered what interventions could be put in place to help those students cope and to decrease aggressive and/or suicidal behaviors. Past research has been done over the effects of season change. It is documented that the fewest number of patients were admitted to a psychiatric clinic for suicidal ideations or actions during the month of May, where the highest numbers are admitted during the months of the fall months and the winter months, but specifically during season change. Cognitive behavior therapy was found to be an effective treatment for patients with seasonal affective disorder and for patients with anxiety disorders. For patients diagnosed with anxiety disorders, there was a study that said that 3 years and 9 months after receiving that cognitive behavior therapy, 53% of those patients reported that they had no symptoms of anxiety, while 63% reported that they had a significant reduction of these anxiety symptoms. Bright light therapy also proves not only to be successful in patients with mood disorders, but also in patients with bipolar and depression. According to Schnell, exercise therapy research has been completed, but it should be noted that results do show that it may merely just distract a person with a mental health disorder from feeling depression or thoughts of suicide when used on its own. But along with the pharmacological treatment, studies suggest that they can be effective when used together. Specifically, lithium has proved to be highly effective in treating those patients with mental health disorders during times of season change. There is a lack of research completed in a non-therapeutic setting. There's also a lack of research in younger children. Ramstad stated that there is research that's been completed on the effects that season changes have and interventions with older teenagers as well as patients inside of a therapeutic setting. But there is that lack of information on long-term interventions that work outside of that therapeutic setting. The goal of the study is to determine the impact of the combination of light therapy, exercise therapy, and positive behavior interventions on students with mental health disorders. This will be measured through the Student Social-Emotional Self-Assessment Social Skills Improvement System, otherwise known as the SSIS-SEL assessment. My hypothesis is that after receiving interventions, students' SSIS-SEL self-assessment scores will remain the same as baseline or will be higher during times of season change. The independent variable is the use of interventions in the classroom, while the dependent variable is those self-assessment results. Impacts of this study is that the results can be used to help teachers create a classroom environment that can help all students, but especially those with mental health diagnoses, to cope during times of season change. With that, also a decrease in suicidal and aggressive behaviors in those students during times of season change. There were 8 participants as part of this study from the ages of 9 to 18 years old. The average age was 13.8. There were only special education students as part of this study due to the fact that I teach at a separate school setting where for specifically special education students. There were varying SES and racial backgrounds. However, students were predominantly Caucasian, and students were from 2 classrooms with similar demographics. The materials that were used is a light therapy box, as well as a visual behavior tracking sheet that went over the behaviors of following directions, being on task, using appropriate language, verbal aggression, and physical aggression. Each half an hour, teachers checked in with students and gave them points, 2 points for each half an hour time block if they did not partake in these behaviors, and they could earn 1 point if there was only one instance of that behavior occurring in that half an hour time block, where 0 points could be earned if that behavior happened more than once in that time block. With that, teachers also gave positive feedback to the students, and students were asked every half an hour to check their own point sheet as a method of self-regulating. Students were also asked to speak positively about their behavior and about their points being earned every half an hour. The SSIS social emotional self-assessment was used. Competencies that were assessed are self-awareness, self-management, social awareness, relationship skills, and responsible decision making. There are 44 questions as part of this survey. The students took the assessment on a Dell Inspiron 3000 laptop using a Safari browser to reach the link. The item responses were by scale. There were 4 options available: not true, a little true, a lot true, or very true. And this was all done under the guidance of a school social worker. The reliability of this test was a test-retest estimate. The reliability coefficients ranged from mid-.70s to .80s. Mean scores between administrations were similar, with the most effect sizes being near .10. This indicates very strong ratings across intervals. For the procedure, a pretest was given at the beginning of the school year where no interventions were present. This was just to give a baseline of where students are functioning socially and emotionally. Again, a mid-test was given in January with no interventions present. Finally, a post-test was given in March. There were interventions in place for 2 weeks prior to this post-test portion. Those interventions looked like 30 minutes of light therapy in a classroom each day. The light was 12 to 18 inches from student desks, and this was on for 30 minutes a day. 30 minutes of teacher-directed gross motor activities. This was split into 3 10-minute increments across each school day for those 2 weeks. And visual behavior tracking with teacher check-ins every half an hour of the school day as part of the cognitive behavior therapy. This research was a 1-group pre-test, post-test design. So 2 phases were compared using paired sample t-tests. The t-test results, they do show that the hypothesis was correct. There was growth from pre-test to post-test scores. The pre-test to mid-test t-scores are 0.158, while the mid-test to post-test t-scores were 0.355. P-scores for pre-test to mid-test were 0.879, while mid-test to post-test were 0.733. Probability value is greater than 0.05, which means that there is not a statistically significant increase in scores. The mean scores overall showed a 2.7% increase. The pretest mean score was 97.625 with a standard deviation of 17.345. A mid-test mean score of 98.500 with a standard deviation of 14.580, and a post-test mean score of 100.250 with a standard deviation of 14.150. The following table shows the results from the testing periods of pretest to mid-test and mid-test to post-test. This is a figure that shows the results of student mean scores for pretest, mid-test, and post-test on the SSIS SEL self-assessment. Connections to past research were taken into account. It's been performed to help students with seasonal affective disorders. A lot of past research has been, and which those symptoms increase during times of season change. One area of research was on cognitive behavior therapy used in schools. A study was performed in a middle school by Shoshani. So 547 7th to 9th graders were studied across 2 years. There was a school-wide intervention in place that was designed to teach students to use positive self-talk as a means to reduce anxiety and depression. It did overall promote positive mental health and decreased psychological symptoms that were maladaptive. Suggestions are to use this form of therapy as a school-wide intervention. Bright light therapy proves to be successful not only in patients with mood disorders, but also with bipolar and depression. Light therapy patients undergoing light therapy from February to mid-March have reported having more energy overall, according to a study by Rockland. According to the Mayo Clinic, this consists of a light therapy box that will give off that replication of natural sunlight. This light is thought to affect brain chemicals and to help treat many different health conditions. According to research by Kurlansky, evaluations have been completed that show that the protocol for light therapy is to place a patient 12 to 18 inches from the light source for 30 minutes a day without direct eye contact. That is what was performed in my study in the classroom as well. Exercise therapy has had several research studies done over a period of 7 weeks. A group of students who were reported to have behavior problems in a school setting were studied where they were given extra exercise time outside of their regular PE class, and they were 50% less likely to act out after that 7-week period, and this is according to a research report done by Norton. Suggested use of exercise therapy in a school setting looks like exercise outside of PE class at least twice a week for 30 to 40 minutes a day, which was taken into account while creating the interventions for the classroom of this study. The theory of behaviorism can be seen throughout this study. According to McLeod, behaviorism is tied to the role that environmental factors play in behavior. This idea of this study came from the idea of changing the environment and in turn helping to change behavior. This looks like positive self-talk throughout the school day, replacing negative thoughts with positive thoughts, and using consistent positive reinforcement as part of that visual behavior tracking tool. Implications show that the research shows interventions do help improve SSIS social emotional scores. The impact on students and teachers are that teachers and students did take part of interventions that are outside of their normal daily routine. Teachers did report 20% less time was spent out of the classroom for crisis behavior, according to daily behavior tracking. They also reported that due to this, 20% more engagement in the classroom was seen. Limitations of this study are that there was a small sample size which looked like only 8 students, and of these 8 students, all were part of a specialized group. They were special education students that had already been diagnosed with mental health disorders. All of these students see outside therapists, and so while outside therapy interventions are being completed, they were not taken into account when looking at those SSIS-SEL scores. Another limitation is that only the post-test was given during a time of non-season change, and this was with the interventions present. If the mid-test had been given during a time of season change without intervention present, the use and the effectiveness of interventions would have been more dominant. Test administration was with myself, who is a non-familiar staff member to students. I do not work with students on a daily basis in the classroom. So this was a limitation in the fact that often students looked to this administrator for making sure that they were pleasing in their answers, and so those scores could be skewed. Some recommendations for future research is to have a larger sample size and a more diverse group of students to see if those test scores would have greater difference among them. Consulting with the outside therapist to see what interventions are taking place outside of the school day would be helpful in figuring out if it's strictly the interventions in the classroom that are helping increase those SSIS scores, or if it's something that's happening outside of the school day. If the mid-test was given during a time of season change, as well as the post-test given during time of season change, this would give a better picture of how those interventions are working during times of season change. Having a consistent staff member as the administrator would help those results on the SSIS SEL from being skewed. It would be a more comfortable testing setting for those students. So this could look like the teacher of the classroom and or the school social worker. Overall, the hypothesis was proven as correct, and the interventions did work in the classroom.